Hi, my name is Kelly. Today we are doing a video showing a catheter procedure for a young woman for nursing 105. Okay, so the doctor's orders for Miss Adams, she was to have voided at least 200 mLs within the past 4 hours. And we were to do a bladder scan, and had she not voided in 4 hours, and we were to see whether she had a greater than 200 in her bladder. She had 400, so therefore the order is to Cath. So I have Miss Renee Adams. Her date of birth is 5/25/1978. According to the paperwork, she doesn't have any patient allergies. I have a catheter kit here, and the expiration date is going to be 8/31/2024. I'm going to provide my patient privacy. I'm going to perform hand hygiene. I'm going to ID my patient. Alrighty, so Renee Adams, 5/25/1978, 5/25/1978. Okay, I'm going to set that down. So Miss Adams, today we are here to make sure that we relieve your symptoms of your bladder fullness. We did the bladder scan and found that you had more than 200 milliliters of urine in your bladder. You were at rate about 400, and we want to help with that. So today we're going to prep to have you straight cathed in order to keep you, help relieve those symptoms. So what I'm going to do is I'm going to prep the area, I'm going to clean it, and then I'm going to insert a catheter into your urethra until urine starts to flow, and then insert it about 1 inch more. After that, we're going to try to empty the best we can. We're going to take a sample of it today, and we're going to then send that sample off and see if there's any infections or anything at this point. So I'm going to put on my clean gloves. Okay. Alrighty. I'm going to take these peri wipes. I'm going to wipe the area. I'm going to wipe, discard, wipe, discard, and wipe and discard. Okay, I'm going to take my gloves off. I'm going to discard that. I'm going to do hand hygiene. Okay, so we're going to open this catheter tray. We're only going to touch the outer corners because we want to keep a sterile technique for in there. We're going to take out this sterile drop cloth, and we're going to place it underneath your buttocks like this. Okay, and then we're going to perform hand hygiene again. We're going to put on our sterile gloves. So we're going to open this up. We're going to open the sterile gloves like this. Again, maintaining the cleanness of the gloves. We're never going to touch the actual fingers of the gloves. So I have my right glove here. That's my dominant hand. So I'm going to touch just the very inside of it and go that way. And then I'm going to do the very same thing with the other glove. I'm going to touch it. I'm not going to ever do anything to contaminate it. So at this point, I don't want to touch anything on the table. I'm going to discard of that just to make space at this point in time. I'm going to prep my tray. So I have my urinary catheter here. I'm going to lay this in the sterile field. I'm going to pull out my betadine swabs, and I'm going to open them up. I'm going to lay them where I can easily reach them. And then I have my lube that I'm going to prep as well. I'm going to just apply a hair bit on the tip of the catheter. Again, keeping it in a sterile environment. Okay, so I'm going to take my non-dominant hand, since I'm right-handed, it's going to be my left. I'm going to spread the labia, and it's not moving. At this point in time, I'm going to take the betadine swabs. I'm going to swab the furthest away from me, going from top to bottom. Discard of that swab. I'm going to swab the closest top to bottom, discarding of the swab. And then I'm going to swab straight down the middle, top to bottom, disposing of that bod. Again, I'm going to then take my urine receptacle. I'm going to place it at the base of the patient. I'm going to pick up my catheter. I'm going to put the open end inside. I'm going to look for my urethral hole. I'm going to do, again, what we stated. We're going to insert the cath using sterile technique into the urethra. We're going to go until urine flows, then an inch further. We're going to let the bladder drain, okay? Then we're going to remove the catheter and discard. And then we're going to take this urine sample and move it out of the way. We're going to wipe using the blue thing, pull it out from underneath her buttocks. Oh, it ripped a little bit. We're going to let go. And then we are going to provide privacy again by draping a sheet back over her legs. We're going to then remove our gloves, perform hand hygiene again, and document. So then, after we do all of this, we have our sterile procedure, or our sterile urine sample. We would lid it, we'd put it in a bag. We would then send it for whatever testing that the doctor has ordered. We're also going to document the procedure. We'll document the amount that we were able to get out of her with the straight cath procedure. We're going to make sure that we document that sterile technique was followed the entire time, and if the patient had any discomfort or any of the above. Ms. Renee, I will give you the time to get back dressed. If you need assistance, I'm more than glad to help you. And I'll be back in to check on you shortly.